You are certainly familiar with the saying, health is priceless. And that's true, of course, but it does have a cost. When it comes to managing healthcare organizations, it's always about reconciling at least two seemingly opposing approaches. On the one hand, the pursuit of the best possible care, and on the other, the drive to optimize economic, financial, and human resources. Why? Because for the most part, the activities of healthcare organizations are funded by the community through taxes or contributions. However, not all healthcare organizations are public. Alongside hospitals, there are private and commercial clinics, as well as private hospitals, non-profit ones. In other words, managing healthcare organizations cannot be reduced to simply running a business or a public institution. Managing a healthcare organization is, above all, about managing people. Between 60 and 80% of a healthcare organization's budget is devoted to personnel management costs. But these people have their own specific characteristics. The vast majority of them are healthcare professionals. Doctors, caregivers, medical technical staff, biomedical engineers. These highly qualified professionals can only be managed in connection with their community, as Mintzberg demonstrated in his description of professional bureaucracy, or more recently, in his work on healthcare management. However, hospitals today are facing challenges in retaining and recruiting their professionals, despite the strong interest generated by their public service mission. Managing a healthcare organization also means knowing how to integrate and handle cutting-edge technologies, which are increasingly expensive and require optimal use in order to hope for a reasonable return on investment. However, these technologies, which serve as the showcase for a hospital or clinic, quickly become obsolete. And in order for a healthcare facility to acquire them, they must receive approval and authorization from various agencies, including the regional health agencies, which regulate and organize the provision of care at the regional level. Managing a healthcare organization also means incorporating patient participation into the various management systems. Thus, patients have dedicated representatives in user relations committees, executive committees, hospitals, and more generally, in systems aimed at improving the quality of care. And this is why the management of healthcare organizations must draw on all the traditional management disciplines, from strategy and finance to production management and information systems, as well as marketing and human resources management. But by assigning a specific role to a unique partner who is not really a client, nor a controller, nor an anonymous beneficiary, but who is the patient.